And a good Saturday morning to you. Welcome once again to Health Matters with Dr. Jim Warner of Warner Chiropractic in Rockford, Illinois. Location is 4855 East State Street in Rockford in the Manhattan Plaza. And it's something that every football player wears shoulder pads for to prevent shoulder pain. That's today's topic, right?
Yes, it is. We're going to talk about shoulder pain, Fred. And most people have had some type of problem at one time or another with their shoulder joint. And so we're going to try to discuss that today and maybe help people that might be out there having problems with painful shoulders.
You know, I think that people who play sports are familiar with that. Golfers, baseball players, pitchers, you know, when they use their arms in sports and they get some pain up in that shoulder area.
Yes, well, see, the shoulder joint is different from any other joint because there's so much you can do with that joint. It's not like your elbow, which pretty much you just flex it and extend it. It just moves on basically one plane. Your shoulder does all the different types of movements. It can, you can raise it forward, you can raise it backward, you can raise it sideways, you can twist it, you can do circles with it, you can internally rotate it, externally rotate it. The shoulder does more movements than any other joint, maybe other than your thumb.
Wow, I didn't know that.
And so that's why one reason why it gets injured so much, Fred, is because it can do so many different movements. Therefore, it's not as stable as, say, maybe your hip joint, which doesn't move as much and it doesn't have that range of motion. The more range of motion in the joint, the more likely that joint can get injured.
I've heard so much about this rotator cuff injury, and I know that's involved with the shoulder.
Yes. Well, there's three things that are commonly found in the shoulder, Fred, and we see more than that, but there's three things that are very common. And interestingly, Fred, the reason why I picked this topic to talk about this is this past week, there was one day where I had three patients come in a row, and they all had shoulder pain. And it was the same shoulder. You know, it was the left shoulder. It was always the left shoulder. It was three of them. And I was thinking, I thought, how unusual that three come in, one right after another. What can I help you with today? Well, my shoulder hurts. And then the next one, well, my shoulder hurts. Then the third one, my shoulder hurts. And it was funny because sometimes it works that way. Sometimes I have three people, four people come in, and it's a headache, or it's, you know, a certain area of their hip or their back or their knee or whatever it might be. And it's funny that it runs that way, that you see that. And I thought, well, there must be a lot of people out there with shoulder problems. And I had other patients other than those three, but those were those three that came in a row.
And this brings up an interesting topic. In chiropractic, you don't work just with the back. Any joint that is affected in some way, chiropractic can help it, right?
Absolutely, absolutely. And that's why a lot of times people come in with joint problems and they don't even know that chiropractic can help that. And we might treat their neck and then their shoulder problem goes away. And they say, well, gee, you know, my shoulder was bothering me. I didn't tell you that, but now my shoulder feels better. And that's because the nerves to the shoulder come from the spine.
I imagine people sleeping wrong on their arm or you know, having their arm tucked under the pillow or whatever it might be causes some of those problems.
Yes, it can do that. So let's talk about some of those three things that you brought up. The first one, let's talk about rotator cuff, because that is a problem that frequently people injure during athletics. Maybe when they get older, they do a certain activity that they don't normally do, and they can tear that or they can injure it. And the rotator cuff, Fred, is a tendon, and this tendon connects to the arm bone in the shoulder. And your muscles that form that tendon are used to help move the shoulder. For instance, you might have some muscles in the back of your shoulder that connect there, and that helps you move your arm. But they all join together to form that tendon. And so if you hurt that tendon, then it affects all those muscles, and that will affect your mobility.
And it's very painful,
too. It's very painful, and if it tears away, you need surgery to treat that. There's no other way to fix that. Fortunately, most of the time, it's not torn, or it's only partially torn, and the body's able to heal itself. And so that's one of the things that we treat. And we try to isolate to see which muscles are most involved and how can we help this. It may mean that we need to ice it down at first if it's a new injury. We might go to different different types of therapy later on: ultrasonic therapy, infrared heat, chiropractic adjustments. Those are things that we do to treat maybe tendonitis, because usually if it's not broken, we could say that's a form of tendonitis because that tendon is inflamed, and so it's a tendonitis, so you would treat it as a tendonitis. Another thing that people frequently have is bursitis. Now, the bursa is a smooth area that the tendon of your biceps muscle goes across. And so people with tendonitis feel pain kind of right around where that biceps muscle is, and they can't move their arm. They can't raise it forward because of that tendon of that biceps muscle goes across that area and rubs it. And so there's friction there, and that causes the bursitis.
And you can have that in other joints as well, can't you?
Yes, you can. Yes, you can. A very common site is that shoulder, though. So you can't treat a tendonitis if it's a bursitis.
And what's the difference in treatment? The bursitis has to do with the little sacs that lubricate, right?
Yes. Well, it's very similar what you do for the treatment, but you got to know where to do the treatment.
I see.
If you treat the wrong thing, again, with anytime there's an itis, whether it's a tendonitis or a bursitis, what that means is inflammation. And
arthritis.
Arthritis. So you need to treat the inflammation and try to lower that inflammation and have the body heal itself, which is, again, what we try to do. So the bursitis is important to recognize. And then you mentioned arthritis, and the arthritis would be where the bones come together. So it might be where your collarbone and your shoulder blade come together. That's called the AC joint. That might be an area where there's actual arthritis. It might be some bone spurs there. It might be inflammation in that area. So you would look to see if it's a bursitis, arthritis, or a tendonitis. And so we notice that when they come in there, that's the first thing that we check to see is which one of these areas are involved. How can we treat that to restore normal mobility to that joint? And if you can restore a normal mobility to that shoulder, the pain usually goes away.
So there is some type of inflammation, no matter what type of problem is causing the pain.
Yes. Now, there can be some other things involved here too, Fred. It could be that the shoulder joint itself just isn't lined up correctly, and it's not really a tendonitis or any of those three things. And I probably find that more than anything. In other words, people come in and maybe they stretched it wrong, or like you said, they just slept on it incorrectly or so, and it's just not moving well. And so a chiropractic adjustment to that joint might restore the mobility there, and then right away, immediately, 10 seconds afterwards, they go, man, I can move my arm again, where they couldn't move it before. So a misalignment of the bones in that joint can cause a problem also. Interestingly, Fred, we've talked about this before on the air, people with gallbladder problems can have shoulder pain. And so we have to check the gallbladder sometimes. And sometimes when people say, well, I got the shoulder pain, and I'll ask them, do you have trouble eating fats? Greasy foods bother you? Well, yeah, they do. Or pizza. Oh, yeah, that bothers me, my digestion quite a bit. That's a good indication that gallbladder is causing the shoulder problem. So then we'll try to treat the gallbladder to get that working properly, and the shoulder problem and sometimes knee problems will go away.
So, interestingly, the gallbladder has evidently nerves that go up to the shoulder.
Yes,
or are connected with.
Yeah, actually, they go from the gallbladder goes to the spine, and then from the spine over to the shoulder. There's a connection there.
There is a connection.
There is a connection.
You could treat a gallbladder problem and take care of a shoulder pain.
Yes, you can. And a knee problem. Now, I don't know how that works with the knee because there's not a direct connection like that with the knee. However, anytime you treat the gallbladder, it, for some reason, helps joint problems. So joint problems anywhere in your body can frequently be due to the gallbladder not working properly.
And I know that you believe that in many cases the surgery is an extreme thing, removing of the gallbladder when it could be treated in another way.
Yes, a lot of times gallbladders are removed when they don't need to be. But when you go somewhere and the only way they treat that is by an operation, that's the only thing you're going to get. And so it's a good idea to see if there's an alternative to the surgery, and that'd be something to call and ask a chiropractor. Is there something you can do so that I don't need the surgery. Sometimes there is. All the time, no. Sometimes the gallbladder has to be removed, but not always.
How about anti-inflammatories to help a shoulder problem?
I don't have any problem with that if it's done on a short-term basis. But sometimes people eat them like candy.
Right.
And they do this for a long period of time, and then they end up with liver disease or kidney disease, which they found these anti-inflammatories. That's what they do. And so you can't take those things from a long term. So if you take it on a short-term basis for a few days, I have no problem with that. But I do have a problem if you start taking it on a long-term basis.
I know that oftentimes chiropractic works in conjunction with physical therapy, physical therapists. Is this good for shoulder problems?
Yes, it really is. Physical therapy works very well on shoulder problems. They work hand-in-hand with chiropractic. In actuality, chiropractic existed before physical therapy, and a lot of the things that physical therapists do were actually discovered or started by chiropractors. And so they've kind of borrowed several different things, but they do work hand in hand.
I know there are things like hydrotherapy and using ice to reduce inflammation, increasing range of motion exercises.
Exercises are very, very important, and a lot of times when you don't have full range of motion, you can only do the exercises to a certain point, and you can't raise your arm all the way maybe. And so you just exercise up to that point. And then there are certain things that can be done, and physical therapists are very good at this, to try to stretch that joint and try to get past the point where it doesn't want to move. And chiropractors do that also, but I know the physical therapy profession does a lot of work with shoulders.
Are there ever lesions, internal lesions, that need to be broken so that you can increase that range of motion?
Yes, there are. You can have what's called a frozen shoulder. And by frozen doesn't mean that it's cold. It just means that it's not moving anymore because lesions have built up in there, and these lesions do have to be gently released so that it can be moved. Sometimes they're so bad, what they do is they put a person under anesthesia so that they're asleep and can't feel it, and then they forcefully move that shoulder joint to get mobility into it, and then you wake up and your shoulder is sore, but you don't know why. But then you need to exercise that joint so that it restores the normal movement.
But no matter what the problem is, there is some way of treating it and making it better.
Absolutely. You need to do that, and you need to be diligent. If you've got a shoulder that's not working well and is a frozen shoulder, the longer you wait, the longer it's going to be to get that thing corrected. So people with shoulder problems should see their chiropractor as soon as possible. Try to get that joint to work properly, and you may forestall or avoid a lot of problems in the future.
All right, I know a lot of people do have those types of problems, and you have more information for them.
Yes, they can contact us on the web at www, that's Warner, at warnerchiro.com, okay, at warnerchiro.com, or they can call us at 815-398-8111.
The doctor was in and on today. Dr. Jim Warner of Warner Chiropractic, thank you so much.
Thank you. Have a wonderful day.
And that's going to wrap it up on Health Matters Today.